Hello, everyone. I'm Bob Dempsey, the Chair of Neurosurgery at the University of Wisconsin, and giving the COVID update for this week. This is November 2021, almost Veterans Day. And I'd like to give these updates when we have something to report. We've been at this for a very, very long time. This is, after all, COVID-19, called that because it was in 2019 when this was discovered at first. And now we're nearing the end of 2021. And people are getting tired, people are getting fatigued, and they can't because we're very much in what I would call the end game. And the end game in chess is when you have an advantage and you begin to develop a strategy to try to end the game. And if we have an advantage over COVID-19, and we do, both medications and vaccines and strategies of isolation and masking, we need to exercise that end game if we are going to get to the other side of this, even though that other side will be different and we will be more careful. But we're that close, yet there are threats. So that's what I thought it was time to talk about. One of the major reasons to talk about COVID right now is that the really big news that vaccines are available widely, and they are now available for children. And that's huge because children have been a major reservoir for the disease. That is to say, even if children's remarkable immune system was protecting them from the massive amount of clinical symptoms, they were still getting the disorder. They were still capable of passing it on to their elders, their families, etc. And that's the sort of opportunity that these opportunistic viruses need. Now, it's very important to understand that episodic swings of these infectious respiratory viruses are a way of life for humans and have been for as long as we know. However, they tend to have a routine, which is that they will be at a low level, make a mutation which makes them infectious or dangerous, have an outbreak, and as they continue to mutate, tend to cause themselves to become less virulent. They become more endemic and less of a problem, and we tend to forget about them going on with our lives. This has been a unique virus because its major mutation of all the many mutations, the Delta variant, really made it successful through a second surge. And we're hoping that we can get past that with these same tools, but that's the challenge. And one of the ways we get past that is take away available reservoir for the disease. So a children's vaccine has been something I've been looking for some time, and that I hope will make life much safer, not only for children, but all those they interact with. Now, the present situation is rather startling. Let's see if I can. Right now, there are over 5 million dead worldwide. Now, that's a big figure, and we tend to think worldwide there's a lot of people. It's not a big deal. 5 million deaths is the equivalent of 20 large passenger jets crashing every day for 671 days in a row. Now, just think about the impact that that means on the world. And so it's no great surprise that a 5 million dead pandemic would shut down economies, would change the world, would change political dynamics, would change our lives forever. And because this is a very big deal. It's affected the United States proportionally. Wisconsin, a little less so, but there are very important lessons to be learned from Wisconsin, and Dane County less so again, probably because of Dane County's remarkable history of vaccination and relatively good record on following masking, separation, etc. These have been the keys. But again, these numbers are undercounts. If you look at worldwide counts for pandemics, we always know that we undercount by as much as half. And when we begin to look at the unexpected increase in deaths, or you talk to the undertakers in some of the countries of the world where funeral arrangements are a necessary religious rite, you see that they have been a very large increase, perhaps twice as many as the numbers we counted and tested and said this was due to COVID. Yet those others were probably as well. And that's even true in the United States, where counting is not perfectly accurate. The situation in Wisconsin is really instructive. If you look at the curves that we've had, the big surge we had last winter, which really shut the state down, shut the hospital down, put us into a panic, was considerable. And yet, as we got vaccinations and we began to understand, importantly, how to treat sick people, our death rates came down, our infection rates came down. And we became quite cocky, actually. By April and June of this year, we really thought we were into the end game. Hospitalizations became low again, ICUs became low again, deaths became low. And what happened? Well, this variant appeared because we were doing a good job with the original beta variant. This Delta variant began to cause things to rise again. And I don't think this was because it was the season or the weather, as some of these viruses are, because this virus seems to work at every latitude, but rather is Delta variant coming back. And it's been very persistent. We've discovered that the Delta variant is imperfectly but well managed by our vaccinations. We've discovered a need for booster shots, which I'll talk about. And we even got an upblip in the people getting vaccinated. But we've discovered a sad truth that there is a large reservoir of people in this country that are reluctant to become vaccinated. And this is for many, many reasons. But we also had a large reservoir of children that could not be vaccinated up until very recently. So the question is, will that increase in vaccinations in children be what we need to really do an end game on Delta? I'll look at the numbers, and I'm very concerned because really in the last 2 weeks, we've seen that this gradual decline, this very persistent plateau of this second wave is starting to turn up again. It's turning up in cases, it's turning up in hospitalizations, very slightly in ICUs, but very persistent in levels of deaths. And our vaccination rates have gone down as we've vaccinated most of the adults that wish to be vaccinated and are beginning only to see the effect of vaccinating children. So what does this mean? I think the best information you can get about this is to look right here at how Delta has allowed COVID-19 to persist. When I think without that, it would have decreased just as many other pandemics of respiratory nature have decreased. Because remember, there are some things that are fairly resistant mutation, and they've been here, and plague, etc. Took hundreds of years to change enough to be mild, or we changed. Whereas these respiratory viruses can change rapidly, usually they change during their pandemic to a less virulent form. Delta was a very lucky mutation for this virus because it allowed it to rise. And you can see on these top curves here, every age group from 12 to 80 plus was improving in the spring, and we were getting decreased, whether we were vaccinated or not, in the number of cases and deaths. And look very importantly that the children, we couldn't really even find many deaths. And the teenagers, very few. And the 30-year-olds, very few. We now know that youth gives you an active, robust immune system, which does a good but imperfect job of fighting this coronavirus. And age, you are absent that. But even with that, in the summer, with the vaccination program, The death rates were very low, even in the elderly. Not zero, but low. And then when the Delta came, it surged. And it surged both in the vaccinated and the unvaccinated. And the deaths surged again in the elderly and began to appear. We had not seen deaths in 65-year-olds to speak of until this fall as the Delta came up. We had not seen anything but decrease in deaths in the 50, 60-year-olds. And we had not seen it at all in the 30s, 40s, or younger. We were beginning to see blips. The children, very little death, but the complications of long COVID do exist in them. So they are not spared completely. And this is just really about being sick or dying. We aren't even talking about the effects of the after effects, the long COVID effects on multi-systems. But a very important thing is seen here is that the separation between being vaccinated and unvaccinated is real. Even though Delta has beaten some of the vaccines, there is a 9-fold advantage of being vaccinated against the Delta compared to being unvaccinated. And there is a 19-fold advantage to be vaccinated against the Delta variant for death. So there's no question, even though Delta has allowed it to persist in vaccinated, the so-called breakthrough cases, but 9 times more frequently in the unvaccinated at all ages, even in the children now. So a response has to require vaccination, has to require vaccination of children, and has to look at the breakthrough cases. These people that got sick that weren't getting sick before when this new variant appeared, even though they were vaccinated. And so several studies took place. This differential suggested that perhaps over time, since most of these people were vaccinated in January, February, the high-risk elderly, was it wearing out? And we found that the immune levels were decreasing in the vaccinated people greater than 6 months out. Now, we don't know what level of immunity you need, but we suggested you need more. And so booster shots were recommended for the high risk, the elderly, who were more than 6 months out. And we know from small studies that they do indeed reboost their immunity and suggest it might become 90 plus effective again, even against Delta. That's very early data, but very encouraging that with booster shots and eliminating the reservoir, we may be able to get an end game even on the Delta variant. And so that's where we're headed. But this concept of infection and the concept of a booster is very important to think about it, because breakthrough infection suggests that I have the shots and I still got it. Well, for most other diseases, that's common. We were really spoiled by the fact that with the first beta variant, those 2 RNA vaccines, which are the most common in the US, the Pfizer and Moderna, were over 95% effective. That efficacy dropped, and we think the booster may return it to that level. And so what about children? Children can sicken. Children can get long COVID, and rare children can die from the coronavirus. But we do know their immune system is rather uniquely protective. It also means that if we were to inoculate them, we had to find the safe dose. What amount of inoculum do they need? Clearly less than an adult per weight. But remember, they can be a reservoir to infect others, not only themselves. And we sent them back to school, working with masks. So now understanding that safe vaccination is possible in them changes everything. And as you know, we're looking at vaccinating younger and younger, but we need to study that and study the doses. because this clearly protects families and people around them. So what are the recommendations? Right now, we have good data about efficacy and safety in these children's dosed vaccines from age 5 and up. We understand this principle of a booster, and that booster would be reasonable for anyone with increased risk. I predict that shortly the boosters will be recommended for anybody after 6 months or longer. I also predict that children below the age of 5 will be vaccinated, but not in this calendar year. The testing of the safety for toddlers, for infants, and up to age 5 is ongoing now, and I don't expect the results before late winter. I did expect the children 5 and up would have results allowing them to be vaccinated by October of this year, and I think we were first week of November when it was actually approved. But what does this mean? It means that we can't give up our end game. I know that Dane County is phenomenally well vaccinated and sensible about masks and distancing. However, that's changing. We've been told the government will no longer mandate it much beyond the end of November. And then common sense is going to be important. I can assure you that the fatigue of just going through this pandemic have worn people out, no matter what their beliefs are, and they'd like to move on. We must do that for our society, our economy, our socialization, our families, but we have to use common sense. And so I do recommend that we understand what this means. Well, the practical implications for UW, ourselves, and the world. Well, UW has made a strong commitment to reopen, to play football games, to hold classes, to be in person. But they have made a very strong commitment to vaccination, have one of the highest rates of vaccination well into the 90s of any school I've ever heard of. And they have kept the campus relatively safe by that approach. Other places in the world and country are not willing to mandate things. Now, the UW is not able to mandate, but they mandate either vaccination or strict testing. Other work environments like UW Health have mandated vaccination, and the rate of compliance is remarkable. It's above 99%, and that makes it a safer place to work. There can be breakthrough, but with the concept of booster shots, we can keep that risk down. Never zero, but down. And that can be a safe place to work. The rest of the world, the rest of our country is not so strict or not so willing to mandate things. So common sense is going to be important. And you need to know, as we begin to open up a society and travel, you still need to protect yourself. Just because it isn't the law that you need to wear a mask doesn't mean it's not a good idea. Because travel is becoming very important. Vaccinated people from other countries are now being allowed back into the United States. Families are being reunited. Travel is taking place. Meetings are being held in person. And people are embracing. You must think about the importance of masking and vaccinating if you're in large groups, because we live in a world where our actions can affect each other worldwide. We have our children in schools. We can now make them safe by vaccination programs. And I strongly believe that that's the way we need to go to get past this, to take this pandemic and this little curve up, down, and to bring it down to where it's just a low-lying thing in society like flu or something like that, that we can live our lives and perhaps periodically get booster shots. That may be true, but it's no different than what we do with flu if we can get it to that level. So what we do is important for everyone, and what we do is basically reflect your thoughts, your beliefs, by the way you care for people. That's all we can ask. But we have hope here. We've given hope. We've made our children safer. we made our society safer, and I think we can do an end game to get past this disease with your help. Thank you very much.